Mental health conditions are common across the globe. In the United States alone, 1 in 5 adults lives with a mental illness. The burden of these conditions is growing and has significant impacts worldwide. But adults aren't the only ones who these illnesses still affect. Sadly, children are also experiencing high rates, which contributes to more negative outcomes. Hi everyone, I'm Matt from Tactics, and today I'm going to explain the impacts of mental health on children. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. More children are experiencing mental health illnesses at high rates. In any given year, 20% of American children receive a diagnosis for a condition, and 22% of American youth will have a diagnosable mental illness with serious impairment by the time that they're adults. Depression and anxiety disorders are some of the most common for minors. Depression is the fourth leading cause of illness and disability worldwide for people ages 15 to 19. And around 13% of children between 9 and 17 have an anxiety disorder. These conditions start even earlier than that though. The median age of onset for anxiety in children is 6 years old. The exact cause of these conditions is unknown, but researchers suggest that it could be a combination of factors. Trauma is one of the most likely scenarios. Over 2/3 of children experience at least one traumatic event by the age of 16. 54% of U.S. families have experienced some kind of disaster, and the average of child abuse and neglect victims was 9.2 for every 1,000 kids. The use of technology also plays a negative role. 66% of children under age 5 exceed the recommended daily screen time. After only 1 hour of screen time use, more hours were associated with lower psychological well-being. High screen time for teens aged 14 to 17 makes them over twice as likely to have a depression or anxiety disorder. Ultimately, these conditions and their causes lead to negative outcomes. Diagnoses continue to increase. This has led to more hospitalizations and ER visits due to mental health. Child suicide and self-harm rates are increasing. Within 1 decade, child suicide rates are up to 150%, and self-harm among girls between 10 and 14 has nearly tripled. Youth are also more likely to be taking medication for their mental health conditions as well. But some of the most common conditions, such as ADHD, are often misdiagnosed and overdiagnosed. One survey found that 20% of children with an ADHD diagnosis had been misdiagnosed. Yet 6% of all kids in the U.S. have a prescription for it. This means that there are children taking unnecessary medication and that they aren't receiving proper treatment. Mental health is a growing concern across all demographics, but especially for children. The longer someone experiences a condition, the worse impacts it can have. People are likely to face these illnesses at young ages with an increased chance for severe impairment. While causes can vary, trauma and high use of screen time are both common factors. Because some conditions have similar symptoms, it's likely that youth could receive a misdiagnosis as well. This means that they won't be able to receive the proper treatment, making their condition even worse. If you'd like to learn more about mental health impacts on children, reach out to Tactics. And you've already made this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.